Hello, my name is Anna McCall. I'm a student nurse at the University of South Alabama College of Nursing, and today I'll be doing my simple lounge dressing change check-off. I'll have my assistant here scan the room. I will begin by checking patient care order form and hospital policy, knocking on the door, and coming into the patient's room, performing hand hygiene and identifying the patient. So I have Jaguar Jones, date of birth August 25th, 1963, date of birth August 25th, 1963. I have the allergies penicillin, allergic to penicillin. I would then gather all my equipment, tell the patient about the procedure, and then I would provide privacy. After I've done that, I would then palpate the wound area, perform hand hygiene once again, and then I would move my bedside table. It will be below my waist level because this is all I have, but in a hospital setting, to maintain sterility, I would keep it above my waist level. I would then have my bedside table here and position my trash can, perform hand hygiene before raising the bed up to a comfortable working height and lowering the side rails. I will then, after I've done that, I will then open up my packaging and retrieving my kit. And once I have my kit out, I will then open it to obtain the mask laying there. I will don on my mask and my goggles. And then also placing a mask on the patient and having them turn their head to the side. After I've done that, I can perform hand hygiene once again before donning on my clean gloves. Once I have these on, I can go on to removing the tegaderm. I will remove it, making sure that I don't touch the catheter. I will remove it, pulling the tegaderm towards the insection site. I do not have a tegaderm now, but I would just like to note that this is how I would remove it, moving towards the insection site until I have completely removed it. Now that it is removed, I will assess and look for anything. I will not touch it because the dressing isn't on. I will note if I see any signs of infection or any complications with the central line. So if so, then I would need to obtain a culture now. So now that I have that done, I will remove my gloves. And discard that in the trash and perform hand hygiene once again. Once I have done that, I can move these out of the way, my pins, and begin opening my kit. Make sure to be aware of the 1-inch border. And then I would obtain my sterile gloves. Being aware of the 1-inch border on here as well. I will don on my gloves, glove to glove, and skin to skin. And using my hitchhiker thumb. I can apply this glove on. Once I have the glove on, I can then move over here to set up everything. All right, to begin cleaning, I would obtain my alcohol swab, keeping my hands above waist level. I am aware that my hands did drop below waist level to open up my kit, but that is just because I do not have a bedside table or anything to place it above my waist. So with the swab, I will now be wiping from the incision all the way out, making sure that I do not go over the same place twice, making sure that I don't do that, and going from the inside to the outside, and then I would drop it in the trash. I would then obtain my chlorhexidine swab, and I would, it's sterile, so I would then pop it on, and using about to contaminate my hand, I will scrub around the site, making sure that I don't touch the incision or the catheter itself, wiping for 30 seconds. With my infected hand, I won't touch the catheter, but I will scrub this for 30 seconds, then I would allow it to dry. Drop that in the trash. Keeping my hands above my waist level, I will then place on the bio patch. I'll grab this again with my unsterile hand now, and then place this on. There. Once I have that placed, I can now open my Tegaderm. Drop that in the trash, keeping my hands above my waist level continuously. And I'll place this here to make sure that we can still see the incision site. And now I can remove the paper from around the Tegaderm. I will also keep the label so I can place my initials, time, and dates on it. After I've done that, I can place the label down. Discard this in the trash. Once I have done that, I can then get everything, all my items, and discard my glove downward, glove to glove, and skin to skin, and discard it in the trash. I will then place my initials, time and date on here, and place it above my dressing. I will then perform hand hygiene, lower the bed, raise the side rails, and put the patient comfortably. After I've done that, I will remove my mask and discard of it, perform hand hygiene again, and then remove the patient's mask and discard of it as well. Once I've done that, I make sure I clean up everything, and then I will go and document the type, consistency of the drainage. I will document the type of cleaner and dressing I used. I will document my name, date, and my signature, and I would make sure that the patient was left okay, and then I will also document the patient's response if I needed to get a culture obtained or anything. And